Hi, Professor Alberti. I'm Rebecca Polipnik, and we are filming my final competency this afternoon. We will be starting with the neurological exam. And as part of the neurological exam, one of the things that we look at is the mental status of the patient. In having an interview session already with my patient, I've been able to tell that her mental functions are very high functioning, and basing this on her appearance, she's appropriately dressed and behaving appropriately. Her cognitive functions are good, and her thought processes are very clear and coherent. But we do need to talk about level of consciousness. So could you tell me your name, please?
Corey.
And the date?
May 2nd, 2012.
Good job. And where are we at?
Lakewood Health System.
Yes, good job. We also are assessing your speech as part of the neurological exam, and that has been very clear and coherent. You converse very well, and your words are articulated very well.
Good.
So next we'll go into the cranial nerves. Cranial nerve 1 is the olfactory nerve, and we won't actually test that today, but if we were, I would have you first test the patency of each of your nostrils by covering one and sniffing through the opposite and then reversing that process. And then I would have you close your eyes and block off one nostril while I held an aromatic scent underneath your nose. Citrus or vanilla is something that's easy to distinguish, and then we would repeat the test on the opposite nostril.
Okay.
So the second cranial nerve is the optic nerve, and this is really looking at the sensory function of your eye. If we were, as part of the normal exam, we would test for acuity by using a Snellen eye chart. And I would have you stand 20 feet away from the eye chart and read through the rows, and to help determine your distance vision. And normal is, of course, 20/20. We also look at confrontation, and this is a test of your peripheral vision. And I need a little something to block off our eyes with, so we're going to just use a piece of paper towel. And I should have mentioned that I have already washed my hands and alcohol wiped all of my equipment before we got started. So in a true clinic setting, we would have little cards or something to have you block your eye with, but we're testing peripheral vision, so if you'll put this piece of paper towel over your right eye, and then I'll do the same thing over my left eye, and then standing in front of you, I'm going to just be flicking my finger out to the side, and just let me know when you can see it.
I know.
Okay, great. And then we'll switch eyes.
Right.
Okay. All right, so I think your peripheral vision is just fine.
Good.
Anyway, it's the same as mine because I saw it at the same time. So we'll hope we're both good. We're also going to take a look at the inside of your eye. I'm going to be looking for the optic disc and the macula, and taking a look at just the internal fundus for color and to make sure that your veins look, your blood vessels look good. So I'm just going to come at you from, I'm going to touch your forehead and just take a peek inside. All right, everything looks good in there. And I was definitely able to see that the fundus is a really nice orangey pink color, and I was able to see your vessels. I'm not very experienced at actually seeing the macula and the optic disc yet, but I'm sure they're in there.
Well, that's good to know.
Okay, so that was optic nerve 2, and then the next one is a group of nerves. It's optic nerve 3, 4, and 6. Number 3 is the oculomotor nerve. Number 4 is the transducens, and number 6 is the abducens. I think it's trochlear, not transducens, and then abducens. And this has a lot to do with the motor function of your eyes. So I'm looking, first of all, at your pupil size, and they are about a 4, and they're both very even. Your irises are very even. There doesn't seem to be any irregularities. I'm going to just take it, I'll just look straight ahead, and I'll just shine my little light across your eye. Everything's nice and smooth. And I don't see any irregularities. So, and then I'm going to attempt to test for indirect pupil constriction. It's kind of bright in here, so it might not work exactly, but we'll give it a shot. Oh, no, that worked just fine. And both pupils constricted like they should. We're also going to test your 6 cardinal fields of vision, so if you'll just follow my finger. And then we'll test for accommodation. And how we'll do that is, if you'll just stare at the picture that's on the wall there, just a minute, and then I'm going to bring my finger up in front of your nose and ask you to refocus on that.
Okay.
Okay, good job.
Yay.
Looks like they're working well. Next, we're going to do cranial nerve 5, and this is the trigeminal nerve. And we will do this by, I'll have you clench your jaws together, and I'm just going to be feeling your masseter muscle and your temporal muscle. Okay, and I'm going to push down on your chin, and I should not be able to open your mouth. All right, good job. Those muscles and that nerve seems to be working just fine. And then, if you would close your eyes, I am going to just test sensory functions on your face. This particular nerve has some sensory functions with it also. So if you'll just close your eyes and just tell me when you feel this little wisp.
Feel it. Feel it.
All right, good job. So the different divisions of that nerve are the oculomotor, the maxillary, and the mandibular, and apparently they're all working just fine. So our next cranial nerve is 7, and this is the facial cranial nerve, and so we'll be just looking at the motor functions of your face. So if you could smile for me and frown. Not a normal look for you. Squint your eyes, raise your eyebrows, and show me your teeth, and puff out your cheeks. All right, it looks like everything's working real well there. This nerve, I believe, also has a sensory function with taste, but it's not normally tested, so we won't worry about doing that. And then cranial nerve 8. Cranial nerve 8 is the acoustic nerve, and we are going to be doing an ear exam with you also, so we'll really wait and we'll do that all at the same time. Cranial nerve 9 and 10 are tested together, and 9 is the hypopharyngeal, and 10 is the vagus. And these are tested using a tongue blade. And we've got this is the one that I haven't honestly practiced before because I didn't have the equipment at home. So, I'll go ahead and put gloves on, since we'll be near your mouth. I've been grabbing all this different equipment. Okay, so I'm just going to have you open your mouth, and I'm just going to hold your tongue down and have you say, ah.
Ah.
Okay, great. And what I was looking for was your uvula and your soft palate to rise up. Mm-hmm. And then also for your tonsillar pillars to go up, and they all did that.
Okay.
I would normally touch the back of your throat, the posterior part of your throat, to test your gag reflex. I'm not going to do that to you. So. Okay. So, all right. I think that was everything for that one. So then cranial nerve 11 is the spinal accessory nerve. And for that one, we're testing the strength of your sternomastoid and trapezius muscles. And you've got your shirt on, so I'm just going to go ahead and feel those. And it feels like they're nice and firm and even, and there's not any wasting or anything. Can you turn your head towards my hand? Against resistance? Okay, good job. All right, perfect. And then shrug your shoulders. Okay, that all seems to be working. Cranial nerve 12 is the hypoglossal nerve, and for that, I'd just like you to stick your tongue out at me. Perfect. Can you hold it for just a second? I'm just going to be looking for any tremors. There's no tremors, no wasting. And can you say light, tight, or dynamite?
Light, tight, or dynamite?
Perfect. All right. So we got through the cranial nerves. Thank you. Next, we're going to be doing a few deep tendon reflexes. We'll do them on both sides of your body. So we're going to do the biceps, and I am going to have it. Yeah, that's perfect. And just let your hand go completely. Your arm go completely limp. Good job. Let's see if I can hit this right. Perfect. Thank you. And this one also. You know what? I'm going to switch hands though, because I'm so right-handed that I'm afraid I'm going to end up hitting your funny bone or something if I don't use the right hand. All right. Yay. As long as I'm on this side, we'll go ahead and do the triceps also, and just let your arm go completely limp. All right, and then this, again, I'm going to use the correct hand. It's your arm totally. All right, thanks. Okay, and then we're also going to test your quadricep or your knee jerk reflexes. So I need to get you just right below the kneecap here. I'm sorry.
It's okay. It works.
It worked. And then this one also. All right. Great. That went very well. So we're going to move on to the cardiovascular exam. So the first thing I'm going to look at with that is I'm looking at your color and your breathing, and you seem to be not having any problems with any circulation, just from what I can see. I'm going to kind of start towards the top and work my way down with this one. So I'm next going to listen to your carotid arteries. And I did, like I said, alcohol wipe my stethoscope so I don't pass any germs to you right here. So I'll be listening at the angle. Oh, and while I'm doing this, if you could just take a real deep breath and let it out completely, and then just hold it while I'm listening. I'll let you take a break between each side.
Okay.
Okay. And then the next side. You want to go and take another breath then. All right. I didn't hear anything abnormal. I could definitely hear your heart beating as I listen down below. The next thing we're going to do is have you lay back, and I'm going to take a look at your jugular vein. Alright, so the external jugular vein is right along the sternomastoid muscle. And I can see just real light pulsations there. The internal is down towards this angle here, and it's hard to distinguish between that and the carotid artery. But the way that you can tell is that the vein will stop pulsating but the artery will not. So I think I am able to see it just right in here. Okay, next I'm going to listen to your heart. And I'll be listening to your heart with both sides of my stethoscope. So it'll take me a little while. There's 6 different areas that I'll listen to. All right, we're going to start at the aortic area. And the pulmonic area. And then we'll listen to the left atria. And the right atria. It's nice and loud. And then the right ventricle. And the left ventricle. And then I'll switch. And again, listening to the aortic area. And the pulmonic. And the right atria, or excuse me, left atria. And the right atria. The right ventricle. And the left ventricle. Before I listened to your heart, I should have done more of an inspection of just your general chest area. Obviously, we're not going to take your shirt off for the camera here, but what I would be looking for is any heaves or lifts or any pulsations in your heart area. And then also for the apical impulse, which is down by the left ventricle at the apex of the heart. And someone small like you, we might actually be able to see it. It's not noticeable in most adults, more in children and young adolescents. So, and then next we're going to be doing, if you want to just lay there for just a minute, I'll be checking some of your pulse sites, and I did write those down. We're looking at the popliteal and the posterior tibial. So, the popliteal is behind the knee. Actually, I'm going to do both at the same time. And they're both equal. And they don't feel like they're bounding or thready at all. We'll say they're a 2+, which should be normal. And then the posterior tibial is just right behind your little ankle knob here. And they're both equal, and again, not bounding or anything. So we'll say those are a 2+ also. I'd also take a look at your extremities and do palpation to see if you have any edema, and you most definitely do not. Maybe after a long day standing at a llama booth or something, huh? But definitely nothing today. Okay, I'll put this in and you can go ahead and sit up. The next exam that we're doing. Okay.
Is it 20 minutes total?
What are we at? Okay. So we're going to be doing the respiratory exam next. So what I'd be doing is, first I'd be doing an inspection of your thoracic cage to make sure that the posterior anterior diameter is less than the transverse, which it definitely is. I would do palpation, listening for any crepitus as I did, and then also any, just seeing if there's any tender areas, any soreness. Do you feel anything?
Nope.
No? Okay. Then we're also going to just check for equal expansion. So I'm going to just pinch up a little piece of your skin, and can you take a deep breath for me? All right, good job. And that equally expanded. We're also going to do percussion just on your back, and that's, I'll be listening for resonance of your lung sounds. And as I get down, going out to the sides, making sure to miss the shoulder blades, and that sounded just fine. And then we'll go ahead and auscultate your lung sounds. I'm going to start up towards the top, and if you could just breathe slightly deeper than what you normally do. All right. All right, we're going to do that again. Okay. Tell me if you're feeling lightheaded at all.
I'm good.
Your lungs sound nice and clear. I'm going to listen to the lateral part of your lungs. Okay, great. And then we do inspection of the front part, or the anterior part of your thoracic cage. And then again, palpation, just for any crepitus, which is something that people with emphysema get, so pretty sure we don't have to worry about that with you.
Don't smoke.
Then I'm also going to listen to your lungs on the front. And again, if you can just take a little bit deeper breaths than usual. Get a nice strong heartbeat in there. Okay, they sound good. And the one thing I forgot to do on the back was to listen for tactile fremitus. Can you just repeat the words 99, or say the words 99? I'm going to put my hands here, here, and here.
99, 99, 99.
Okay, great. And the most important thing there is just for it to feel equal on both sides, which it did. Okay, last thing. We are going to take a look at your ears. I can tell by conversation that you're able to hear fine. We're going to do just a brief whisper test. But first, we'll do the inspection of your ears. So they're both nicely shaped, equally sized. I'm going to take a look at the inner, or at the external canal, looking at the tympanic membrane. I'll just pull up slightly on your pinea here. Make sure this isn't warm at all. Just move this around. All right, I can see your tympanic membrane, and it's nice and pearly gray. And same thing on this side. You've got the best ear canals I've seen yet. Don't tell my last patient. All right, so then I'm just going to pull on your pineas a little bit. Do you have any pain at all in that area? Pushing on the tragus? No? Okay. And like I said, from conversation, I can tell that you're hearing just fine. We're going to do a whisper test also. I'm just going to push your tragus in and say something, and you can repeat it for me, okay?
Okay.
All right. Okay, good job. Kathy's a great boss.
Kathy's a great boss.
And then we have a couple of little tests that we're going to do with the tuning fork. The first is the Rhine test, and I'm going to strike this and get it humming, and then I'll put it behind your ear, and I just want you to tell me when you don't hear it anymore.
Okay.
Then I'll move it to your ear, and I'll see if you can hear the residual hum.
Can't hear it anymore. I can hear it.
Okay. I'm looking for equalness on each side.
Can't hear it anymore. I can hear it.
Okay, great. And then the next is the Weber test, and what I'll do is I'm going to strike this again and put it on the top of your head, and you should be able to feel it equally coming down to your ears. It's kind of like a bone conduction hearing.
Feel it or hear it? I think I can hear more on my right.
Okay, that happened when I did it at home on somebody too. So, okay, interesting. All right, so we did the neuro, we did the cardio, the respiratory, the ears, and we did test that the sensory nerve for hearing as part of your ear exam. So that seemed to be just perfectly fine.
Okay.
That was all I had on my little list that we got, so I think we are done. Thank you.